Lyme disease is in the spotlight, with Justin Timberlake telling his fans he was diagnosed with the disease during his tour. According to the Public Health Agency of Canada, there has been a steady increase in cases of Lyme disease over the years. So let's bring in Dr. Isaac Bogoch, infectious diseases expert with the University Health Network. Good morning, doctor. Great to see you, and thank you for making the time to speak with us about this. Many, hearing more and more about Lyme disease. Maybe we could start by talking about what this is and when someone would really realize, hey, this is something that I need to get checked out.
Yeah, this is a tick-transmitted illness. We've had this in Canada for decades and decades, but what we're seeing now is more and more of this in Canada as tick populations are able to survive and thrive in more northern latitudes. After the bite of a tick, maybe about 7 to 14 days after a tick bite that's infected with this, people can get a rash at the area of the tick bite. It's got a very characteristic appearance. It looks like a target. And then there's classic signs and symptoms of Lyme. People might have some muscle aches and pains, particularly joint pain. Sometimes the joint pain can move between various joints on the body. Sometimes people have neurologic manifestation and occasionally even cardiac manifestations as well. People will feel pretty crummy. But again, it's if you're in the right environment where these ticks are biting, if you have those compatible symptoms, it's definitely time to go seek medical care. A physician in Ontario has access to Lyme diagnostics. It's a simple blood test that's very accurate. And of course, if any tests are positive, the treatment is antibiotics, and the antibiotics that treat Lyme are readily available in Canada.
The symptoms, though, it sounds like they're kind of similar to like a bad cold or a flu when you mention, the aches or fever, anything like that. How would someone know, oh, this might be a little bit worse?
No, that's a great point. And in fact, that's not unique for Lyme. There's many illnesses that have overlapping signs and symptoms. And I think that's the key thing when you seek medical care. One of the questions that the clinician will ask is, have you been bitten by any ticks? And of course, only about 25% of people with Lyme don't remember the tick bite because, of course, they're small and they can be in hard to see or hard to reach places. But they might ask where you were, if there was a potential for tick bites. And even if that doesn't come up, they still might order a test if someone was in a particular area where Lyme is known to occur. It's on what we call a differential diagnosis, meaning someone has some symptoms and signs of a particular illness, but it can be many different illnesses, and the clinician will think about a ranked order of potential illnesses that can be causing that. Lyme, especially at this time of year, is often on the list and needs to be ruled out.
And you mentioned antibiotics, usually the treatment that would be used if someone is diagnosed with Lyme disease. It seems like more and more we're hearing about people who have talked about how uncomfortable it is, how, difficult it is to deal with Justin Timberlake. He was on tour. People noticed he didn't really seem like himself. How bad can it get if it is left untreated?
If it's untreated, certainly people can have ongoing symptoms, including neurologic symptoms and musculoskeletal symptoms. And, sometimes the clinician doesn't recognize that this is Lyme early on, or people don't seek medical care, and it can have more longer-term manifestations. Fortunately, the vast majority of symptoms in the vast majority of people will go away with appropriate antimicrobial care. But, we do know that Lyme, like many other illnesses, some people might have ongoing symptoms even after appropriate antimicrobial care. But even in those cohorts, fortunately, most people do end up recovering after several months, sometimes longer, but usually after several months.
Lastly, how do people protect themselves from this, especially during the summer months when, a lot of us are outside and many of us traveling up north and we're spending times in campgrounds, areas where you might see a few more ticks?
Absolutely. I think the first thing to recognize is let's not be afraid of this. I mean, we have beautiful summers in Canada, and we should be enjoying them outside as much as possible. But there's a few things we can do to reduce the risk of tick bites. We can wear long pants and long sleeve shirts, which is helpful, but of course it's not that practical if it's 30 degrees outside. Other things we can do are use insect repellent. Items and products that have 30% DEET or 20% dicardin are very effective in reducing the risk of tick bites. And finally, when you come in from being in wooded areas or areas with tall grass, those are areas that ticks like to populate. Just have a good look over your body for ticks and remove them right away. And it's also helpful to have someone look on hard to see places on your body, maybe behind the legs, to make sure that there's no ticks there. The ticks actually have to be attached, usually for more than 24 hours, sometimes even longer, for Lyme to be transmitted. So if someone has a tick bite, just remove it right away. But of course, if there's any questions or concerns, have a chat with the healthcare provider about this.
Sorry, did you say the bug could be attached to you for 24 hours?
It actually has to be attached longer than 24 hours
wow.
in most cases for Lyme to be transmitted. So let's say someone goes out, they get a tick bite, and then they remove that tick bite within a matter of hours. The probability of Lyme transmission is extraordinarily low in a case like that.
Okay, that's great to know. Something to certainly watch for then and how to respond to that. Dr. Bogoch, we appreciate your time as always. Thank you so much, and we'll check in again soon.
My pleasure. Have a great day. Thanks for having me on.